The CDC says pediatric COVID cases have risen dramatically and are now at their highest since the start of the pandemic, especially among children who are too young to get the vaccine.
Nationwide, hospital admissions have jumped by nearly 100% in just the past week. News 8's Shannon Handy spoke with the head of infectious diseases at Rady Children's Hospital and has more on what is happening locally. Shannon?
Here at Rady Children's Hospital, in the past week, the number of kids being admitted with COVID has tripled. Right now, there are 20 kids in the COVID unit and 2 in the ICU. But doctors say, fortunately, there have been no child-related deaths locally connected to COVID. And the children who have COVID have very mild symptoms.
I don't want people to worry that children are in the hospital sick with COVID. The numbers are high. We average 20, 25 kids in the hospital at any one time who are COVID positive, but they're coming in, going out, coming in, going out. So it's not like these are chronic infections.
Dr. John Bradley says many of the children testing positive are coming in for something else, but per protocol, they are getting tested for COVID, and that's when they discover they have that as well. With that being said, the Omicron variant is spreading very quickly, and doctors say that's why it's so crucial for eligible children to get vaccinated, because not only can they spread it within the community, but there's a growing concern about MIS-C, an inflammation condition in kids related to COVID.
Fatigue, myalgias, these kids feel horrible. Occasionally the hearts are also infected, and there's no virus there anymore. This is all of these kids are antibody positive. They're immune, but the body thinks that the virus is still there. And a publication from the Centers for Disease Control that just came out Friday says that if kids are vaccinated, it prevents MIS-C as well as preventing active infection in children.
Dr. Bradley says MIS-C usually shows up about 4 to 6 weeks after someone is infected with COVID. So he expects a wave of MIS-C patients at the end of this month following this recent surge. And by the way, it is now recommended for children ages 12 and up to get the booster. Children ages 5 and up are eligible for the vaccine.